Hello everyone, my name is Misraj Taddasa from Ethiopia, the organization named Professional Alliance for Development.
Hello everyone, and how are you? This is Dr. Work.
Our issue of advocacy is for epidemic preparedness budget advocacy.
And actually, the capstone project for the Ethiopia was to advocate for the creation and disbursement of funds for epidemic preparedness in army or district in Amhara National Regional State in Ethiopia. Now, we are so happy, proud, and excited about to announce that we achieved our advocacy all goals, and the current district administrations are allocated 500,000 Ethiopian not involved in the monetary terms. The big win for us is that this is in the first time to allocate the budget for epidemic preparedness response, and the district has never allocated funds for the epidemic preparedness previously. And also, despite the civil casualties of the district, they still decided to allocate some funds for the epidemic preparedness. So in the present time, the funds are now being used to prepare for the recurring the mentioned outbreak.
The Warda Council has given an order for the Warda Finance to open a joint bank account, so that this bank account can be used for epidemic preparedness activities. 3 persons from the Warda Health Office, from the Warda Finance Office, and also from the community representatives, so that which will support on the sustainability, accountability, and also transparency of this activity. Got this letter of appreciation. And for the takeaway from the academy is the first one is that the skill, the knowledge that we have got from this academy is that we have never done such kind of activities, especially on advocacy. Now we are able to do that because of the knowledge and the skill that we have got from the academy, and especially the media advocacy that we have used it very wisely. It really does supported us on achieving this great achievement. So we have got this knowledge from the academy, especially on each and every steps of the activity, on how to do how to assess the stakeholders, how to even analyze and understand the budget cycle, and how to proceed with the workshop so that we can go with the government officials and the mentors that we are so grateful, especially Tayo and Emmanuel. We have achieved this one because of their support, especially their invaluable guidances on how to do these activities, and also especially on how to manage our workshops and the like. So we have got a lot of things from the academy. Actually, it doesn't seem possible to get such a great achievement within this short period of time, but we are able to do that, which shows us that the ability, the potential that we have got to do this advocacy activities. So hope that to do this in the future in collaboration with you all. And finally, congratulations to everyone in the academy. Thank you.
And how are you? Global Health Advocacy Incubators families. My name is Shetu Imam from South Global Health Department. My job responsibility is Public Health Emergency Coordinator. Through strong advocacy, we observe fruitful outcomes. Like, for instance, there was no budget allocated for our district this year. However, through strong and intensive advocacy, our government administration and councils understand the relevance and importance of the issue, and they allocate 500,000 for our district. Through strong advocacy, our local investors and influential persons and volunteers show willingness to support preparedness activities, and Finally, on behalf of the people of Kalu District, I would like to thank PADET and its supporters, Global Health Advocacy Incubator, for strong support and guidance we received so far.
My name is Celeste.
I am Blessing and we are representing Lopeco Foundation from South Africa.
We are excited to be graduating from the GHAI CSO Academy and we want to say congratulations!
After our landscape analysis, one of the biggest challenges we identified was the lack of sustainable financing for epidemic preparedness in our provincial budget. Despite the lessons from past outbreaks, the government only allocates funding for response as opposed to preparedness. Additionally, Gauteng province, despite being the most populous and economically significant region, it does not have a dedicated budget line for epidemic preparedness in its health budget. This means that resources of epidemic prevention, response, and mitigation are not guaranteed, leaving the province vulnerable to recurring disease outbreaks.
One of our biggest challenges we identified was the gap in media advocacy for epidemic preparedness. While health security is a critical issue, there is limited public awareness and engagement due to lack of strategic communication. Without media-driven advocacy, epidemic preparedness remains a low priority in the public and political agenda, making it difficult to secure dedicated funding and policy action. Our capstone project was on advocating for the creation of a dedicated budget line for epidemic preparedness in Gauteng province.
Through our advocacy, we engaged key policymakers, mobilized community support through petitions, and launched the Pre-Epidemic SA campaign to push for epidemic preparedness funding. Our petition calling on the Gauteng province to create a budget line for epidemic preparedness received an overwhelming 1,500 signatures. As a result, our advocacy effort, the government has recognized us as an authority in the budget advocacy and health security space in the country.
The Academy was truly transformative. It strengthened our skills around stakeholder engagement and mapping, making it easier to engage the right decision makers through advocacy. The Academy was instrumental at equipping us with essential media advocacy skills. We learned how to develop strong media engagement strategies, how to craft compelling advocacy messages to help both decision makers and the public to understand the urgency of epidemic preparedness funding. We learned how to engage traditional and digital media, and were able to ensure that our campaign reaches wider audience and created public pressure for public change. Most importantly, we learned about the national budget cycle and how to analyze the national budget, which gave us a deep understanding of how to effectively advocate for sustainable public health financing. As part of this journey, we contributed to community petitions, organized key stakeholder meetings, and worked on media advocacy to increase public awareness around epidemic preparedness financing.
A huge thank you to the Academy for this opportunity. I would highly recommend that the CSO Academy to other advocates. The skills we have gained will have a lasting impact on epidemic preparedness advocacy in Gauteng province and in the whole country.
My name is Amos Male from Center for Reproductive Health and Education in Zambia.
Hi, my name is Blenga Chingambo. I'm also from Center for Reproductive Health and Education. Through our work with the Academy, we identified the need for a dedicated budget line for epidemic preparedness in Lusaka district. The goal of our capstone project was to advocate for a dedicated budget line for epidemic preparedness in Lusaka district by September 2025.
We strengthened collaboration with other stakeholders, such as the Ministry of Local Government, the Disaster Management and Mitigating Unit, the Zambia Public Health Institute, and one thing that we learned during the academy was how to build strategic partnerships, which are crucial in budget advocacy because it amplifies diverse voices. And by working together with other organizations, we created a strong and more sustainable advocacy resulting into long-term policy change. We are glad that the Budget Committee at Parliament level were able to adopt one of our key recommendations, that is to ensure that the budget line for epidemic preparedness is created in the national budget, and that will influence the creation of the budget line at sub-national level. So we are excited and we look forward to ensuring that the budget line actually has allocation from the national budget.
We also took away skills on impactful budget advocacy. A key takeaway was learning that impactful budget advocacy goes beyond seeking more funding. It's about strategically influencing government resource allocation to drive tangible changes in spending priorities. So by using evidence, building stakeholder relationships, and setting up coalition and holding decision makers accountable, we gained the tools we needed to shift resources towards critical areas like epidemic preparedness, creating lasting impact. Thank you so much for the opportunity to be part of the CSO Budget Advocacy Academy. CRH is deeply grateful for the impactful program and the chance to learn and build our capacity in epidemic preparedness advocacy. The skills we gained from the platform on domestic resource mobilization is particularly important now due to global funding cuts. We're excited to apply this knowledge to improve Zambia's financial capacity to be prepared for the next epidemic or pandemic.
Hello everyone. The recent COVID-19 pandemic has taught us that embracing an integrated One Health approach, as well as having a responsive and resilient health workforce, are very important in tackling public health emergencies. In this respect, it is important for countries to develop strategic plans and guidelines that will better position them to be able to detect, to be able to prepare, to be able to prevent and respond to public health emergencies effectively. Consequently, the academicians from Tanzania and from Kenya championed and contributed in developing health workforce set guidelines and One Health strategic plan, respectively, in their countries. Please help me in welcoming the academicians from Tanzania and from Kenya as they share with us key achievements from their capstone project. Thank you.
My name is Biwot Kipiogazel. I work for Kenya Red Cross as a program officer in charge of community-based surveillance for a community epidemic and pandemic preparedness program.
My name is Brian Ikala, as a policy advocacy lead under the International Center for Material Affairs, abbreviated as ICHA, which is under the Kenya Red Cross Society.
Yes, Kenya Red Cross has been supporting counties, and for this case, it's Tharaka Nithi County to enhance its epidemic and pandemic preparedness efforts through a One Health approach. And as a result of this, we supported the county government to develop a costed 5-year One Health strategic plan that covers from 2025 to 2029 to enhance its sustainability for epidemic and pandemic preparedness interventions. The One Health strategic plan will support the county One Health unit to mobilize financial resources to implement key interventions to improve health security in the county.
So the goal of our capstone project was to advocate for the adoption and installation of the One Health Strategic Plan 2025-2029 by the County One Health Steering Committee and the County Assembly in Tharaka Nithi County.
Yeah, based on the knowledge and skills that we gained from the 9-month CSO Academy, we did convene an high-level advocacy and dissemination meeting with the County Assembly leadership, the County One Health Steering Committee, the County Assembly Committee members in charge of health and sanitation, agriculture and livestock, and finance and planning to approve, print and launch the One Health Strategic Plan.
And on the 20th of November 2024, we supported the County One Health Unit to launch the strategic plan, with which it drew attendance from key stakeholders, including the County One Health Steering Committee and the key partners. And so we are proud to say that the county governor, in his state of county address on 3rd of December, listed the strategic plan, one of the key documents for the county.
Yeah, for the last 1 year, we've learned so much. Of course, we can't list them, all of them, but just to mention some few areas that we learned is we gained a lot of understanding on how to develop advocacy messages on epidemic preparedness. We did learn how to engage and bring together key stakeholders to achieve our goal. And now we do understand how to support even accountability frameworks for epidemic preparedness.
And so I would like to thank the Academy and everyone who's in the Academy. Would like to say congratulations. Would like to definitely commend the Academy for the mission, which is extensive, which has extensive experience in health security. The CSO Academy is extremely crucial as it has helped us gain valuable skills and knowledge on accountability and epidemic preparedness budget advocacy, which we were a bit lacking on it. From my end, I'll say thank you.
Thank you so much.
Hi, my name is Mwajebu Mbaruku, also famously known as NJ, and I work as the Programs Administrator for the Benjamin Mkapa Foundation.
Habari from Tanzania, my name is Rahel Sheiza. I also work with Benjamin Mkapa Foundation as the Director of Programs and Business Development.
So we conducted our landscape analysis based on the results and findings from the joint external evaluation that was done in country sometime in 2023, was that we had a really low scoring on issues related to personnel deployment, guidelines or strategies that will be used during public health emergencies. So as an HRH organization, we thought it best to take it up during this time to advocate for the country to incorporate or include issues related to personnel deployment during public health emergency.
The goal of the Capstone project was to advocate for the government to commit in the health sector priorities for the financial year 2025-2026 and allocate funds accordingly for the development and implementation of the personnel deployment guideline for public health emergencies in Tanzania.
So our Capstone project was focused on that, and we aimed at advocating for the government of Tanzania to first commit to the development of these personnel deployment guidelines, but also allocate funding towards the implementation. And the best way to do that was to ensure that they incorporated as the health sector priorities for 2025-2026.
As a result of advocacy, the key sector ministry committed to the development of a national mass sector personnel development guideline that outline how healthcare workers can be protected during the public health emergencies.
So some of our achievements included that the key sector ministries endorsing the development of the national multi-sectoral strategy, including the personnel deployment guideline, but also the Ministry of Health and its key stakeholders in human resource for health endorsed issues around global health security and personnel deployment guidelines. And these were officially done through the sector-wide approach meetings, including the HRH technical working group meetings, and is now on the way of being incorporated and included as a health sector priority for 2025-2026. So some of the things that we take away from the Academy, I think the deep dive itself into the concept of global health security helped us a lot in terms of learning and fact-finding about what was happening in the country, and this gave us leverage even as we spoke to key decision makers and held dialogues with government officials. It helped us understand where we were and where we stood as a country. But another thing was also, we also learned about the importance of having a flexible advocacy agenda, because as the environment was changing, there was a lot that was happening during this time. We were changing decision makers, but also the country context itself was changing. So having an adaptive and flexible advocacy strategy also was key to help us push forward regardless of what was happening in the country. So to my fellow academicians, after 11 months of what was intense learning, I would say let us continue to carry through what we've learned, what we've shared, and making sure that we continue advocating and making an impact in matters of health security in our respective countries. Kwaherini.
Together, we have built strong and resilient coalition of change agents. We have been strategically incubated, and we are now matured to incubate the world through our single and collective agenda to a sustained legacy.
Good afternoon. My name is Justinian Katera, the in-country coordinator for Global Health Advocacy Incubator in Uganda. A key component of the GHAI Budget Advocacy Toolkit is accountability, which tracks the allocation and disbursement of funds meant for epidemic preparedness. It also identifies the bottlenecks and barriers to disbursement in order to suggest policy options that improve the budget process. The CSO participants from Uganda, that is Samasha, and from Nigeria, NHED, implemented their capstone project on budget accountability based on priorities identified in the landscape analysis. It is important to point out that the CSO partners continued the work that GHAI had commenced in Kano State, Nigeria, and in Uganda. NHED implemented the institutionalization of the Kano State Health Security Accountability Framework, while Samasha learned important lessons on the disbursement of approved funds for epidemic preparedness in Uganda. Permit me to invite Team Nigeria and Team Uganda to share with us key accomplishments from their capstone project.
Cornelia Thiwe from Samasha, reporting from Uganda.
Hello. Good morning, good afternoon, good evening. Gift here from Samasha. Greetings from Uganda. Cornelia and I today will be sharing our experience on the capstone that we implemented the last 6 months.
The issue we sought to address as part of our capstone project was focusing on budget accountability. We wanted to see how much money that is actually allocated to epidemic preparedness is spent towards surveillance and response. In the financial year 2024-25, our government of Uganda committed about $15.4 million towards epidemic response and preparedness. Through the budget tracking, our goal of the project was to follow this money to see how much of this money was actually released and disbursed on time, and hoping to have at least timely disbursements of at least 25% by the end of the period. Within the 6 months of implementation, we were able to see and document incredible progress. Of the total allocations made, government had allocated 5.5 billion, an equivalent of $1.7 million by December 2024. Of this amount, about $600,000 had actually been released and spent by Ministry of Health under the vote on public health emergencies and lab and diagnostics. During this same period, we were able to provide technical assistance to the Ministry of Health and Office of the Prime Minister to finalize and launch the National Action Plan for Health Security running from 2025 to 2028, whose total budget was $295 million.
Achieved some wins, especially with regards to prioritization of epidemic preparedness, and we're happy to say that in the next financial year budget, government has made it a requirement for all MDAs and local governments to allocate portions of their budgets to epidemic preparedness and financing, acknowledging it as a cross-cutting issue. We further raised awareness through a social media campaign on X, through targeted messages on the importance of financing for epidemic preparedness, and this helped us reach a wider audience and engage them in our advocacy efforts. We also noted increased civil society participation in the health security space, especially in the response to the Ebola and Mpox outbreaks. Moving ahead to what the key takeaways are for us in this academy is that we learned that allocations alone are not enough if they are not backed by timely disbursements. I also noted the importance of having strong partnerships, as these act as catalysts for successful advocacy. So we learned that we cannot do this alone, but we can only get a long way if we work together. It's been a great experience with the Academy, and we are very grateful for the Global Health Advocacy Incubator for giving us the opportunity to participate in this academy.
Hello everyone, my name is Oluwatoyin Adehomi.
Hello everyone, my name is Tessim Hina.
We are from Network for Health Equity and Development based in Nigeria. We are passionate about strengthening health security accountability. Hence, our capstone project focus on health security budget accountability in Kano State. We identify a critical issue in our landscape analysis, the lack of effective health security accountability, which severely hinder data accessibility and transparency in health financing. This gap directly impacted Kano State government's ability to respond to health threats effectively. In addition, the Kano State Health Security Bill, essential for operationalizing the health security plans, and the Kano State Center for Disease Control was awaiting the governor's approval, creating a significant bottleneck.
So, the goal of our capstone project was to bridge this gap, and we aimed to do that by enhancing the Kano State health security accountability through enhancing access to data and institutionalizing the health security accountability framework. Simultaneously, we also focused on securing the governor's approval of the Kano State Health Security Bill. Our advocacy effort was multifaceted and collaborative. We conduct series of engagements with civil society organizations, government stakeholders, and even members of the media on the need to institutionalize the health security accountability framework and the need to advocate for the governor's approval of the health security bill.
We facilitated a series of impactful media engagements across various media platforms, and we also engaged directly with government officials, stakeholders, and secure agreement from key ministries to utilize the accountability framework for tracking health security financing for the state.
This strategic effort culminated in two momentous achievements. One, the Kano State government adopted our health security accountability framework and made a commitment to utilizing this framework for tracking health security financing in the state. Two, the Kano State government approved the health security bill for Kano State. This momentous achievement marked a turning point for health security financing in the state. It is worthy of note that Kano State is the first state in Nigeria to pass the health security financing bill. And as at February 8, 2025, when this bill was passed, Kano State was the only state that had done that. The Global Health Advocacy Incubator's CSO Budget Advocacy Academy was very instrumental to our success. The Academy provided us with key tools and knowledge that we used, to achieve this milestone. One very significant one for us was the training on media advocacy, and the lessons we learned from it was what we deployed to gather the support of the media and by extension the public to gain the attention of government. Our ability to communicate our goal effectively was what garnered the necessary support we were able to mobilize for health security in Kano State. We also gained skills in policy analysis, which enabled us to document evidence-based analysis and present a compelling case for the health security accountability framework.
Thank you, and congratulations to everyone in the Academy.
Colleagues and fellow graduates, It is a great honor to stand before you today on behalf of the 7 organizations that have participated in this year's GHAI CSO Budget Advocacy Academy. This program has been truly transformative, equipping civil society organizations with the tools to drive impactful change in health financing. At LOPECO, we have seen firsthand the immense value of this academy. I saw great value in the program for Blessing and Celeste, as well as for our entire organization. Their experience has significantly elevated LOPECO's credibility, and we now are recognized by the Gauteng legislature as key advocates for a dedicated budget line for epidemic preparedness. Through the Academy, Blessing and Celeste refined their advocacy strategies, strengthened their stakeholder engagement skills, and leveraged the media to amplify community voices on epidemic preparedness and financing. The impact has gone beyond individual learning. It has fortified our entire organization. The structured mentorship and hands-on application of budget advocacy toolkits allowed us to integrate new strategies into our work, ensuring epidemic preparedness becomes a policy and budget priority in the Gauteng province. With this in mind, I strongly recommend the CSO Budget Advocacy Academy to other CSOs. The mentorship was exceptional, and we saw remarkable growth in our staff's ability to apply advocacy tools in the real-world settings. Most importantly, our engagement with the Gauteng legislature has made epidemic preparedness a key agenda item thanks to this academy. On behalf of all participating organizations, I extend our deepest gratitude to the GHAI team for believing in civil society's role in shaping public health policy. To the graduates, congratulations! Your work is just beginning, and the impact you create will shape the future of epidemic preparedness in your countries. Peace be with you. I thank you.